Η επόμενη ομιλητριά μας είναι η Σίρι Μπενάρζη. Είναι ιδρύτρια και διευθύνουσα σύμβουλος του MCI Medical Coaching Institute και διακεκριμένη εκπαιδεύτρια, αν και διαγνώστηκε με μια σπάνια χρόνια ασθένεια το 1999, με την ιατρική πρόβλεψη να της δίνει χαμηλές πιθανότητες επιβίωσης, τα προσωπικά και επαγγελματικά επιτεύγματά της μέχρι σήμερα αποδεικνύουν ότι υπάρχει πάντα επιλογή για τον ασθενή, την ιατρική ομάδα και όλους όσους τους περιβάλλουν. Τα τελευταία 15 χρόνια, η Σίρι συνεργάστηκε με διεθνείς κορυφαίες φαρμακευτικές εταιρείες, ιατρικές οργανώσεις και νοσοκομεία, όπως MSD, GSK, Teva, Pfizer, GlaxoSmithKline, Sanofi, το Υπουργείο Υγείας του Ισραήλ και πολλά άλλα. Το όραμά της είναι να προάγει την αλλαγή στο ιατρικό σύστημα μέσω του medical coaching, των επικοινωνιακών δεξιοτήτων, του στένους και της εκπαίδευσης του κλάδου σε θέματα υγεσίας. Coaching executives through health disturbances in a Vuca world. Siri, I would like to invite you up here.
Okay. And the microphone? Okay, shalom and welcome. Wow, this is a mouthful, okay? Coaching executives through health disturbances in a Vuca world. I'm going to add a few words before I go, and I'm just going to say that other than, the things that you heard about me, which I hope is a translation of everything I sent, because then I know it's good, I want to tell you that I have 2 birthdays. The first is on the 23rd of August, 46 years ago, when I was actually born. And the second is on the 18th of May, 20 years ago, when I was brought back to life. Because I was actually pronounced clinically dead. I was brought back to life, and like my doctor said, I'm a stubborn bitch. But what I realized was the key to radical resilience. And that's something I want to bring to you through a coaching perspective as we talk about this. So, we're actually going to talk about the connection between Vuca and health disturbances. However, we're going to use the executive perspective. Why? Because the executives are the leaders of our age, especially if we're looking at the business world. So, when we're looking to make a change in an organization, we can go from the bottom up, but it's going to be faster if we go from the top down. So let's start with Vuca. Who has come across the concept of Vuca? Yay, you. And you, and you. Good. And you know the acronym? Yes. Yay. Perfect. So, Vuca stands for volatile, uncertain, complex, which is different than complicated, and ambiguous. So now let's break it down and understand what that means, because it sounds like a disease, honest to God. Okay. So, volatile goes to the nature, dynamics, and speed of changes, but not just the change itself, but the change forces and the change catalysts. So these are the things that create change. And what we know lately is that they have a changing dynamic, they happen very, very fast, and we don't always see them coming. Uncertainty goes to our lack to predict, okay? We are missing information, because information is changing, and because we're missing information, many times we cannot tell what's coming. Now, how can we run a business, or how can we create social change, or how can we manage and facilitate a process if we honestly cannot predict where we're going? Complexity, which is different than complicated, because complicated, like my grandma goes, it's like, oy vey, complicated. But this is complex. So complex means we have a lot of parts moving, a lot of, things that are variable. So think a machine with an engine, a lot of moving parts. And ambiguity means the uncertainty of meaning or intention. So if in the past we could look at cause, okay, and then look at effect and make the connection, nowadays we're a little bit confused, okay? It's not a linear connection. We have quantum leaps. We have connections that are spiraling. A doesn't always lead to B. So it makes it ambiguous. Let's say something about Vuca in organizations, okay? One thing I can say about Vuca in organizations, it's become a sexy word, which pisses me off, because I think it's not just sexy, and I'm going to talk about that. So Vuca is used today in the context of management and leadership. It actually comes from the US Army, okay? And this was a term that was coined, pre-Cold War. Then it was taken into different theories around management and leadership, and now it's a buzzword. It has turned into both a principle and learning models. So people create learning models that are based on Vuca principles to create awareness, to create readiness for change, to create operation modes in different situations, to prepare interventions, to evaluate performance, to create peak performance. People are using Vuca for everything these days for a good reason. The capacity of individuals and organizations to deal with Vuca is something that is now measured and it's enhanced. For the sake of peak performance, for the sake of leadership, we want to make people more and more high functioning in a Vuca world. Is that good or bad? I'm going to say both. It can be good and it can be a catastrophe if we don't pay attention. So we said a few words about Vuca. Let's talk about health disturbances. Because usually when I say health disturbances and I connect it to executives, people say like, what? How's that connected? Because usually when people think about health disturbances, they think about someone sick in a hospital bed. Wrong. There are 3 ways we come across health disturbances in the workplace. First of all, through caregivers. Caregivers are people that are caring for someone else. Now I want to say this. The baby boomers, my generation, and the millennial generation are the generations that for the first time become double caregivers in the middle of life. In their 30s and their 40s, they are caring for aging parents and they're caring for young children. We never had that before. This means because people died younger. So people are living longer today, but they are sicker at a younger age. So we have parents at the age of 60 and 70 already sick. They are not independent. They're thrown out of the workforce because they're going into pension, and they are becoming our dependents. So we have double caregivers. Now, and that is even before we threw a health disturbance into the equation. So imagine someone like that, employee or executive, aging parents, young children, and now imagine the spouse has cancer, the child has diabetes, the parent has a geriatric illness. We have someone that is so overwhelmed, they start a process of chronic stress. We're going to talk about that in a few seconds. So the first disturbance is caregivers. We don't see them because they don't wear a sign, but they're there. They are here. They are us. The second health disturbances is invisible illness. Invisible illnesses are illnesses that you don't see. I have an invisible illness. I'm living with a heart and lung condition. Do you see? No, you don't. If I wouldn't tell you, you wouldn't know. Diabetes is an invisible illness. Endometriosis, fibromyalgia, okay? IBD illnesses, Crohn and colitis. These are illnesses that don't show, but they take a lot of resources. Now, here's the funny thing. In order to feel empathy, we need a visual cue. If we see someone scarred, if we see someone with an expression of pain, if we see someone on a wheelchair, we have a visual cue. Our brain goes ding, ding, ding. Okay, activate empathy. And then we know that this employee, the reason that this employee is resting right now and is not keeping up with a deadline is because they are sick, they are in pain. Oh, empathy. But if I don't see a wheelchair, I don't see scars, I don't see an expression of pain, I don't have any visual cue, this employee is not keeping up with performance, my brain doesn't say ding, 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 empathy. They go like, that person is lazy. And I go into judgment. And this is the big issue with invisible illness. There's a gap between the way I experience myself and the way others experience me, because there's an entire portion of my life that's invisible. These are executives and employees that are constantly struggling. They need to invest 200% into an assignment that requires 100%. And number 3, and this is what we're going to focus on, is burnout. And what I want to say as a medical coach is burnout is very different than the regular stress. And I'm going to go into that. I only have 15 minutes, so I invite you, by the way, after that to come ask me some more questions. Okay, let's talk about burnout. Burnout in the workplace is characterized by 3 dimensions. First of all, emotional exhaustion. We're talking total depletion here. Now, everyone that works in the business world works with people, meaning they need emotional resources. You talked about emotional intelligence. I'm with you 100%. We need that in order to function because we live in a society. If I am depleted from emotional resistance, I have no patience, I have no tolerance, I have no ability to listen, to show empathy. Okay? So there's a depletion of emotional resources to connect and contact with other people. That's a real problem in a workplace. Number 2, depersonalization. So we're talking about negative feelings, cynical attitudes towards the recipient of the services or care. So whether this person is an executive or a team leader or even doing customer service, and they are holding negative feelings and a cynical attitude towards the people that are about to receive service, we have a problem. It's like, Houston, we have a problem. Number 3 is reduced personal accomplishment. So this is a tendency to evaluate oneself negatively, particularly in regarding to work, which means that if we strive to cultivate the human resource and invite employees to fulfillment, because fulfilled employees create a strong organization, and fulfilled executives create amazing leaders, and they inspire other people, when they are burned out, this is not happening. They do not feel fulfilled. On the contrary, they feel absolutely worthless. And you know what? They perform lousy. So Houston, we have a problem. So now let's talk about burnout. Because burnout is a term that's used to describe chronic stress related to a stressful working environment. Meaning that burnout is a manifestation of chronic stress. Now, I work with a lot of healthcare practitioners. Do you know the term for burnout in the medical world? It's called compassion fatigue. Compassion fatigue. Now, think about this, about the horror of this name. When you have a doctor or a nurse that have no compassion because it's absolutely fatigued. Oh my God. But that's the professional world for burnout with medical practitioners. What I want to say to you is this. As coaches, with our basic training, we are amazing when it comes to acute stress. We are clueless when it comes to chronic stress. I want to show you the difference because it's directly connected to Vuca. So first of all, what is stress? Stress is not a condition. Stress is a reaction. It's a response. In order to be stressed, we need a stressor, like an activation button. Now, stress is both physical and psychological, and it's a response. And the thing that happens when we respond, we have a stressor, and we go into response of stress, our normal function changes. So if our normal standard of performance is high peak, that will change. Let's talk about stress. We have acute stress. Everybody knows what acute stress is. It's a short-term exposure to a specific stressor. Deadline, marriage, divorce, birth, promotion, firing. By the way, the stressor can be a very positive, okay, event, like marriage. Although some people say, oh my God, marriage is not positive at all. Okay? But it can be a promotion or a relocation, something that I really worked hard for and I'm waiting for. Then when it comes, it creates stress. Acute stress we know how to deal with. Chronic stress is an ongoing exposure to one or more unresolved stressors. Okay? More and more we are going from this to this. Now I want to say something. Chronic stress means a chemical mess in our body because it means we have elevated levels of adrenaline and cortisol for long periods of time. When we have them for short periods of time, we get peak performance here. And this is how a Vuca event can really make us perform at our best. A Vuca event can be the best thing for an organization. But when an organization or a person lives in a Vuca world, Houston, we have a problem. Because chronic stress, elevated levels of cortisol and adrenaline affect us on 4 levels. Physically, they affect bodily symptoms, meaning we don't digest, our immune system is compromised, our heart rate is compromised, our blood vessels are compromised. That's on one level, physical. The second level is neurological. It messes up the electricity, the way our brain works, the electric impulses in our brain, the neurotransmitters in our brain. Meaning, by the way, that we have trouble processing new information, remembering, prioritizing. We have a problem connecting with perspectives. We have a problem making a decision. All the things that we work with in coaching. So that's the second level. The third level has to do with our hormone system. It messes us our hormones. Now, I train a lot. I used to train a lot in Ireland, and in Ireland there's a saying that in Ireland there are 4 seasons in a day. People that suffer from chronic stress have 4 moods in an hour. Now, it might sound funny, but subjectively speaking, you feel like you're losing your mind. You feel like you're emotionally unstable because the emotion response is not proportional to the event. Now, it's not because you're losing your mind, it's because you're not balanced. Your hormones are not balanced because of cortisol and adrenaline. And the 4th level has to do with behaviors. Because of all of the above, our behaviors are not proportional. Our anger is not proportional, our sadness is not proportional, our happiness is not proportional. We go through extremes. So this is what chronic stress does in the body. Now, if we go to Vuca and we live there, then we increase the chances of chronic stress and burnout. So what I'm saying is that the way back is to create Vuca events, meaning that even though we live in a Vuca environment, what we need to create are downtimes. We need time to recuperate between one Vuca event to another so that our system can recharge itself. And then we can enjoy those lovely levels of, the oxytocin and endorphins. There's a whole biological aspect to that. Again, I only have 15 minutes, so trust me on that. And then come ask me questions later. But I want to show you how it affects performance. So let's look at this chart. We have performance going from low to high. We love high performance. Okay. And then we have challenge. Low challenge, high challenge. We live in a high challenged world. Now look at the graph, because it goes up, which is what we want, high performance and high challenge, but something happens here and then it goes down. And I want to show you what happens. So at the beginning we have healthy pressure. Okay, now stress is healthy. We need stress, some level of stress in the body, or we're dead. Okay, so healthy pressure, our performance improves, we challenge ourselves more, We go into optimal performance, okay? Those are those Vuca moments, okay? And then at some point, it's too much because we didn't give our system a chance to regenerate. And we go into a hyperreactive stage. And this is where our resource starts to deplete and our batteries start to empty. And then we go into emotional and physical exhaustion. And this is my world, okay? Damage to health and breakdown. And this is when you come to me. So why is this important that we as coaches know that? I mean, we can send people to a doctor. Why not? But it is important that we know that because there's a relationship between stress and illness. And I'm just going to say a few words about the term psychosomatic, because psychosomatic is not an invented illness. It's a stress condition. And psychosomatic illnesses are illnesses or disorders that are triggered or worsened by emotional and mental factors, meaning stress. And by the way, experts estimate that 75 to 80% of all health-related issues, including a lot of types of cancer, are related to stress, are actually psychosomatic. That's mind-blowing. So, coming from a place of radical resilience, because that's my thing, I actually want to take Vuca and flip it on his head and give you a model to work with it. So if we take the V, okay, volatile, we use vision and values in order to deal with a reality that is volatile, because those are going to be our anchors and the vision is going to be our lighthouse. To deal with uncertainty, we need to unlock and undo the stressors. To deal with complexity, we need that communication and human connection to help us navigate through complexity. And in order to deal with ambiguity, we need a sense of agency, resourcefulness, and we need emotional agility. And that is the way we create the down, recharging and resting, so we are prepared for the next Vuca peak. So, one last thing before I wrap it up. Wow, felt like a marathon. Little present from me to you. So take out your phones, take a picture, send me an email. First of all, tell me I look gorgeous, because I love pink. And if you do, yes, I want to send you a little gift, okay? I have a free mini course, digital, which is all about coaching tips, skills, and tools to support your clients and people that you love through health and medical disturbances, okay? Gift from me to you, from my heart to yours. Thank you very much. Toda.